The body's response to injury is inflammation. In the early stages, it's helpful. Valuable chemicals are released in balance that stimulate white blood cell migration to the injured area. White blood cells also release chemicals to repair the injury and protect the body from infection. However, aging, overuse, trauma, and other factors may overstimulate the body's inflammatory response, causing the chronic swelling and pain that is often associated with osteoarthritis. The response becomes self-perpetuating, stimulating more and more inflammation. Understanding the metabolic pathways involved is crucial to developing the best therapeutic approach for OA. Cell injury results in release of arachidonic acid, or AA. Each enzyme system, COX-1, COX-2, and 5-LOX, convert AA into certain inflammatory chemicals. These chronically released chemicals exacerbate pain, swelling, and stiffness. Reactive oxygen species, or ROS, are produced with inflammation and injury as well. Oxidative metabolism of AA by ROS produces molecules which lead to more cartilage destruction, along with those metabolic byproducts generated from AA by COX-1, COX-2, and 5-LOX. Early NSAIDs primarily inhibited COX-1, but COX-1 was found to have physiologic functions, most importantly, protection of gastric mucosa of the stomach lining. To address the problem of stomach ulcerations, new NSAIDs were developed that were more selective for COX-2. These COX-2 NSAIDs had improved short-term safety regarding stomach ulcers, but were still associated with renal toxicity in dogs, just like the older NSAIDs. One possible explanation is that decreasing the COX-2 flow decreases the production of a kidney vasodilator, and increasing the COX-1 path flow allows a vasoconstrictor to further decrease kidney blood flow. This combination compromises renal perfusion. These problems may be due to shunting of arachidonic acid metabolite production toward the 5-LOX pathway, as well as greater generation of ROS. This shunting effect also occurs with traditional NSAIDs. Leukotriene B4, a metabolite produced from arachidonic acid by 5-LOX, attracts neutrophils to the site of injury and has been found in high concentrations in the stomach wall of patients with NSAID-induced ulcers. What is needed is a more balanced approach. Specifically formulated for safety, FLEXILE RX contains both COX-1 and COX-2 selective ingredients, thus providing balanced, equal COX-1, COX-2 inhibition. FLEXILE RX also provides 5-LOX inhibition and has a free radical scavenging antioxidant effect 5 times greater than vitamin E. FLEXILE RX provides an elegant solution to the arachidonic acid metabolic imbalance. In 9 animal toxicity studies, no adverse effects were seen, even when dosed up to 40 times the label rate. FLEXILE RX, balanced metabolic management of canine osteoarthritis without adverse effects.